Hello, gorgeous. Welcome to HG Radio, everything beauty, cancer, and inspiration. Here is your co-founder and host, Kim Becker.
Hello, gorgeous, and thank you for joining us today. I'm your host, Kim Becker, and this is Hello, Gorgeous, everything beauty, cancer, and inspiration on Society Bites Radio, social interaction for the mind and soul. This episode is brought to you by Amplified Marketing Group. They specialize in affordable mobile solutions that will get you noticed and help you retain customers. Check them out at yourphoneguy.com. Our guest today is Colleen Sweeney. Colleen is an RN, BS, CSP, and is the founder of Sweeney Healthcare Enterprises, and she's on a mission to transform healthcare. Having spent a lifetime in healthcare as a nursing student, nurse's aide, graduate nurse, registered nurse, educator, manager, director, and an administrator, Colleen conceived and conducted the Patient Empathy Project, a 3-year research study. During this research, she discovered that 96% of all patients have serious fears about healthcare. Colleen put this finding to use, developing the Patient Experience Pyramid as a tool for healthcare teams to uncover and respond to patient fears. She also identified the top 11 patient fears. As a keynote speaker, consultant, coach, Colleen has helped hospitals and long-term care organizations to return to their mission, put best practices in place to drive out chaos, and coach leaders to realize their full potential. She helps caregivers understand the why behind what they do and how their care can forever go down in a family's history. A member of the National Speakers Association, Colleen has been awarded the highest speaking designation in the speaking profession, CSP, a certified speaking professional. Only 12% of all speaking professionals hold the designation of CSP, and Colleen is one of only 23 nurses in the world with this credential. Colleen holds degrees in nursing and business and a master's certificate in project management. Hi, Colleen, and welcome to the show.
Hey, Kim, that introduction is so long. Are we out of time yet?
No, but when I read it, there wasn't anything in there that I felt like, oh, I could leave that out. I could leave that out. No, we needed the whole package today. We needed everybody to know everything about the work that you've done because it's incredible. And it's so right. Like patients fear going to the hospital. And even now, especially in the midst of COVID, they fear it.
Oh, more than ever. Fear has just become so complicated anymore. Patients are fearing it. In fact, they're staying away. But now it seems that the fear is on the other foot as well, in that people are those providing care are now so fearful. Mm-hmm. And so fear goes both ways. So I think when all this settles, it's really going to work to the patient's advantage in the long run, patients in general, because I think that those on the providing end are going to know, hey, we know a little thing about fear now. So There you go.
That's right. Well, and I think that that's so true, right? Because you don't know what you don't know, number one. And until you walk in those footsteps, whatever it be, whether you're the patient or the nurse or the doctor, you can't truly understand. You can't, there's always a saying that I live by, which is you can't read the label from inside the jar, right? So when you're on that inside, like you have no idea, you know what you know, and that's it. You really can't visualize it from the other side until you walk in those footsteps.
You are so right about that. I love that. I'm going to remember that.
Yeah, I use that all the time because it is so, you cannot read the label from inside. It's so true. It's so true. So I have to share the story. So I met you, I was trying to think, it may have been 10 years ago now.
I think it was.
I met you. So I was at I think it was a luncheon for the YWCA for like they were awarding like a Woman of the Year award, and I was asked to attend with a friend of mine, and you were the keynote speaker. And I was so impressed. And of course, that was my dream, is to be on stages and to be able to speak to large audiences. And you were so impressive. I thought, there's no way that she can be from South Bend. Like, there's no way that you could be from my hometown because you were just that good. I figured they paid you thousands and thousands of dollars and flew you in from, someplace else. Well, and I'm a big one for modeling. So, I don't have to reinvent the wheel. I just need to find somebody that's doing what I want to do and then talk to them and follow the steps that they took in order to get to where they were. And so you were so gracious enough. I reached out to you. I think it was email back then. Facebook wasn't as big 10 years ago. And I reached out to you and I introduced myself and told you what I wanted to do. And you so graciously met Michael and I for lunch. And I think it was like a 2.5 hour lunch that we sat there and talked about the work that you did and the work that you were doing and what you aspired to be. And the one thing I remember about your speech, so in the 10 years since I did first sat and talked with you, I remember one of the business coaches that I worked with said, you want to be remembered beyond the parking lot. So you want to give such an incredible speech that people are talking about you beyond the parking lot, not just that they got in their car, that Monday morning when they go back to work. And so that speech that you gave that day, 10 years ago, you talked about pictures that you put on your refrigerator, about places that you wanted to go, and basically like a vision board that you put on your refrigerator. I still remember that to this day. And my vision board expanded from the refrigerator to a huge dining room wall. So, so thank you for telling me about what was on your refrigerator at that point in time. So you were certainly remembered beyond the parking lot that day.
That is so amazing. It was 10 years ago because it's before I officially started my business and moved to Florida, where we're now headquartered. And I remember thinking, I have no business even doing this keynote speech. And a friend of mine who was on the board of directors at the Y asked me to do it. And I think they had no budget. And so I thought, this is practice. I'm going to do this. And it's certainly, I've never spoken about my vision board ever again. But I remember that day. I remember it was like 2 or 3 days after my mother had passed, and I had made a commitment, and I thought, I'm going to do this. And it was very, very hard for me. But I do remember it. I remember meeting you. That was amazing. That seems like a lifetime ago. Thank you for remembering that. Thank you.
Oh my gosh. Well, and like I said, you're very good at what you do. And obviously you were meant to do that because, 10 years and a move to Florida and all the transitions that we've made as an organization, you and I love the relationship that I have with you because I feel like I can just, like this morning, we had just a quick chat. It's like I talked to you yesterday. Like, yes. I may not talk to you for a year at a time. And whenever we get on the phone, it's like, oh, we just pick up right where we left off and we just keep talking. So
like sisters.
Anyway. Yes.
Absolutely.
Yes.
We share the same heart. There's
yes.
no doubt about that. No
yes.
doubt about that.
Yes. So I know that you were a nurse for a really long time, but did you purposely set out to do a study about patients' fears so that you could start a speaking business? Was that your whole motivation?
Oh my heavens, no, not even a little bit. So what happened was I worked at a hospital in South Bend, and I was what was at the time called a director of customer service. That title doesn't exist pretty much anymore. It's now a patient experience officer or director of patient experience. And I was very new to the position. I had been a bedside nurse before, and I thought, I don't really know what to do in this role. It was brand new to healthcare also at the time, 15 years ago or so. And I thought, well, I don't know a lot about this and, customer service and the patient, but I do know the power of the first 3 seconds. And I thought, maybe we need to put people inside the front doors of the hospital so that they could greet and walk with and direct people who walk in the front doors of the hospital. And because we stationed people at the front doors, I thought I need to take my turn. And so once a week, I would stand out there and say good morning to our hospital, and how may I help you? And it was one day a lady came in and she told me that she was having surgery, and I noticed her hands were shaking when she was registering. And I said, are you all right? And she said, no. She said, I am so scared because 3 people that I know died at this hospital. And I said, I'm so sorry. And I go on to tell her how great our hospital is and now all these awards we've won. And she said, oh, I know you have a great reputation. She said, but it is, your hospital has a great reputation, but she said, that's the only thing I have inside of my head when I come into your hospital. And I thought, oh my gosh, I've been a nurse for like 30 years and I've never given thought to what are preconceived ideas and experiences that patients have had before they ever even reach your door. And so I went back to my office. I asked two of my assistants, tell me, if you were to be a patient in the hospital, what would you fear? And they immediately, like it was on the tip of their tongue, they give me an answer. And so I just said, this is like a real thing. What if we found out what patients fear and addressed it? Would it change the experience, not only for patients, but would it change the experience for us who do the providing of care? And so for 3.5 years, I did an interview study where I asked people what their greatest fear around their hospitalization was. And then one day a friend asked me to speak about it, and I was actually scared to death to speak. And then I guess I found myself in business, the wildest things, but that's how it all started. Not intentional at all, but God had other plans for me, I suppose.
Well, but how I always feel like it's asking a question, right? So, my story and losing Michael, and we have free will, so I can even be bitter or better. It's up to me. But instead of being bitter, I ask, what am I supposed to learn from this?
Right.
And so I feel like that's what you did with this, right? You took their fears and said, what am I supposed to learn from this? And then you took it one step further. What am I supposed to learn from this? And then how can I use it for good?
Yes.
So you've taken all of this. So how do you share this information then? Do you share it with the healthcare professionals? Do you share it with the patients? And how do you relay the information that you derived from your study to people that could really utilize this?
That's interesting. So as fate would have it, at the same time I was doing this study, there was a government survey in the works. So that's how long ago it was. The survey was actually in the works. And it's called a CAP survey, where patients are asked a series of questions in different categories about their hospital experience. And the funny thing is, a good friend of mine who heads up something called the Barrel Institute said, would you speak about this? And I'm like, well, it seems so stupid, to be speaking about what patients fear. And when I was done, actually, it was a company in South Bend, Indiana, the Prescini, who does patient survey. There was someone in the audience who was a C-suite person the first time I ever spoke, and there were probably only 90 people in the audience. And they said, what your study directly correlates to the questions that are asked on the survey. So it was, for me, all about timing. And then to know what patients fear, and if we could address it, would totally change the experience for patients, therefore change the survey, which has financial implications for hospitals and healthcare organizations. So it was all about timing. So I often say, had I done this study 30 years ago, I probably never could have started a business, because I'm not sure if anyone would have really cared. But now it became incredibly significant with the advent of the CAP study and the government survey.
Wow, you're right. And timing is everything. So how awesome that all came together at the right time.
Absolutely.
So is there something that every patient should know that would keep them safe while they're in the hospital?
Oh, yes. So every patient should know that although every year we in healthcare nursing, I believe, is voted one of the most trustworthy professions that there is, that during the course of your hospitalization or while you're under the care of whether it's medical practice or a hospital, that there are hundreds and thousands, or maybe hundreds of thousands, I'm not quite sure, endless processes that go on and pieces that go into your care. So many pieces involve communication, everyone getting everything just right. And because there are so many moving parts to you being a patient in the hospital and so many people having a hand in your care, that the likelihood that something could possibly go wrong or there could be a communication is actually fairly high. And so I believe that every single person needs to know that they can question their care, first of all.
Mm-hmm.
If they happen to be alone, that they can question everything that is given to them, meaning medication, every treatment, every consultation. They can question everything, and they deserve an answer in a way that they completely understand, because we have a tendency to do the medical speak, and the average person has no idea what we're talking about, but never once, no one wants to feel stupid.
Mm-hmm.
And so people just shake their head, having no idea perhaps what they're signing a consent for, or the treatment what a treatment or a test involves. That's the one thing. And the other thing is that every person needs to have an advocate, if at all possible.
Mm-hmm.
They need to have someone who will advocate for them, who will be there at the bedside, if at all possible, or be in communication with your care team and pretty much question everything. And I don't mean question in a negative way, but question everything to the point where you have an answer that you're pleased with, that you totally understand.
Mm-hmm. Well, and I don't think that people understand. So I'll share with you. I last November I had to have surgery, and I decided that if I had to have surgery, it was going down this way. And I knew that I was going to go in, and then I was going to be in the hospital for like 4 days. And I too was nervous. And I thought, okay, what's going to make me feel more comfortable? And so I told both the surgeon and the anesthesiologist, I said, okay, this is what I want. I said, I want to be wheeled into the operating room. I said, I want Don't Stop Believin' by Journey playing on the radio. I want everybody singing, and then you can put me out. And so we get on there, they're taking me down to the operating room, and my friend that works at the hospital was there, and she had Don't Stop Believin' played. So we get in there, and the anesthesiologist said, look, you just heard Don't Stop Believin'. I'm not playing that now, but I'll play you a different Journey song. And so he had to do something that he had to do for the anesthesia part. And so they were getting ready to lean me back, and he's like, okay, now I'll play your song. And they did it. They played Don't Stop Believin'. Everybody was singing. And that's the last thing I remember until I woke up in recovery. And so I don't think that, that's just one example.
I love that.
I don't think that people realize that you can, they're serving me. So if that's what I needed, now I'm not saying if, you had a 3-piece band that you wanted to come in, I'm sure there's a line that they have to draw, but there are things that you can request to make sure that you are comfortable, whatever. And that, to me, I wanted it to be, I knew if they were singing a song that everybody knew, that they were at ease, and I needed them to be at ease so that I felt at ease. Right. And so I don't think that people know that there's certainly things like that you can request. I really, it's your stay. They're there to serve you.
That's so interesting, Kim, because the other thing it does, you requesting a song and to have them sing, it makes you a person. It doesn't make you a case or a chole or whatever the surgery would be. It makes you a real person, and it causes them to see you differently.
That's right.
That's why I always say, as a patient, to have a picture at your bedside, to have a kid's artwork, your grandchildren's artwork on them. It makes them look at you as the person that you are, instead of a room number or a case number. And so that's brilliant. Good for you. Good for you. I love that.
So tell me, how do you think that nurses and physicians are faring in the current climate, just considering the pandemic right now? Like you said early on in our interview that, they're all everybody's fearful at different levels. The nurses and the doctors are fearful for one reason, the patients are fearful for another. So how do you feel everybody's faring?
Not well. I honestly believe not well. And we throw around the term hero, and we have seemed to attach it to healthcare, though, nurses and doctors, respiratory therapists, those providing care. But I'll tell you, it is way beyond that. So most of us have had stay-at-home orders or been quarantined, and we're doing our best to avoid this invisible threat that we, are unable to see. And they run towards it every single day. And it's just very complicated. So I can tell you, I'll just give you a little snapshot. At first, there is this thing in healthcare that's hard for non-healthcare people to understand, but it's an adrenaline thing where it's almost like exciting. Like, is this going to happen? You know, when will we get our first case? And I know that I do a lot of consulting, so I have clients all over the country and quite a few in the Northeast. They were excited at first and so disappointed when they had their first patient come in with classic symptoms and they tested negative. And they were like, oh, here, we thought that was it. No, so this was so early on. And the next day, they went from a 15 to a 50-bed ICU, and they described it as getting hit in the face with a brick.
Wow.
And then they watched as their own died, you know, just all of these patients lined up because you can make anything in ICU, and they watched their coworkers die, and pretty much in a state of shock for weeks. And it was, I think, indescribable for them. And many just barrel through it and feel like, you know, I can't stop to get help. And many of them at this point who have had really have been in the thick of it. So those in New York City, and now it's going to happen here in Florida, and it's happening in Arizona. They seriously will need trauma therapy when this is over. Wow. Seriously. And so it has been very hard. It's a complicated thing, you know, it involves family, it involves decisions that you never thought you'd have to make. And there's just a lot of things. You know, I had a doctor who said, I never in a million years thought when I took my Hippocratic oath that I would one day come into work and ask to be on a team who'll decide who lives and who dies. That's heavy. That's very heavy. So not well, I would say, and understandably so.
And it'll be really interesting to see how the face of healthcare changes when this is all over with because of that. You know, because of what people have seen on the front lines, because of what they've had to see day in and day out. It'll be really interesting to see how this changes. And so what do you think? What kind of changes do you foresee going forward in healthcare?
Whoa. Well, just like the airline industry changed radically after 9/11, I believe that healthcare will, oh my, we have so much to look at. I think one of the good things that will come out of it, and there are some really good things that will come out of it, although it's very hard to see when you're in the thick of it, is telemedicine. I think that when you look across the demographic of those who access healthcare, they were not always trusting of telemedicine. And now organizations have gone from doing very little telemedicine to almost totally telemedicine. And the fact that it's working, you know, and there's those that will report very few visits in their emergency department. And that's because, you know, people are accessing care somewhere. And there's so many things that can be done by telemedicine. That is one of the very, very good things that will come out of it. But I think that you'll see lots of changes, and a lot of them for the better. I think a lot of them for the better.
I think so too. I think as time goes on, like what you said, you know, 9/11 transformed us. It wasn't fun to go through, but it certainly, it certainly transformed us as a country. So I feel like this will transform us as a system as well.
I totally agree.
So believe it or not, we are almost out of time. So tell us where we can find more information about Sweeney Healthcare Systems.
Oh, well, we have a website, Sweeney Healthcare. It's Sweeney Healthcare Enterprises.
Oh, Sweeney Healthcare Enterprises, yes.
Yes, Sweeney Healthcare Enterprises. It will pop up, or follow me on Facebook, Sweeney Healthcare and Enterprises, and that's SHE. And you can find me either place. I'm on LinkedIn. Colleen Sweeney will get you to any of those places. Luckily, I've been doing this long enough that I come up fairly easy. If you put patient fears in, pretty much my name will come up. So you can take a look at the work we're doing, our mission in India, and lots of good things. So there you go. I'd love to connect.
Awesome. Well, we are almost out of time. So thank you so much, Colleen, for joining us today. I appreciate you taking the time out of your schedule to speak with us.
Oh, it is such a pleasure, Kim. You know, I just think we're like best friends that only talk every once in a while, and it's an amazing thing. Thank you for everything you do.
Oh, well, thank you. If you have any questions or comments or would like to know more about the guests on our show today, feel free to contact me at kbecker@hellogorgeous.org or visit our website at www.hellogorgeous.org. We invite you to follow us on Facebook, Instagram, and download our mobile app. Thank you for joining me today on Hello Gorgeous, Everything Beauty, Cancer, and Inspiration. I'm your host, Kim Becker. Until next time, stay gorgeous.
Another beautiful day, walking in the sunshine, spending the time with you. Last night we had a good time, dancing in the moonlight and loving the night away. I can't imagine what it'd be like. I can't imagine what it'd be like. I can't imagine what it'd be like without you. I can't imagine that.